Good afternoon, and thank you for joining us again today for another Facebook Live session with CPS Energy. I'm Melissa Sorolla. I'm the Interim Senior Director for Corporate Communications and Marketing for CPS Energy, and we have some very special guests with us today. Safety is one of our guiding pillars, and COVID has really changed the way that we've had to look at that and enhance that from an employee standpoint, and also how we've interacted with our community. So today you'll hear some about the best practices and the things that we're doing as a company. And along with our President and CEO, Paula Gold-Williams, we have a very special guest, Dr. William Henrich, the President and Professor of Medicine at UT Health San Antonio. We also have with CPS Energy, Lisa Lewis, our VP of People and Culture, and Jesse Hernandez, who's our Director of Community Strategy and Engagement. Also on our team, you don't see him, but the man behind the logo, Adrian Garcia, who's running the show for us. And we're also thrilled to have Dario Garcia, our ASL interpreter, with us again for our hearing impaired guests who are watching right now. We do have captions enabled so you can read along during the meeting. And following this meeting, we will repost the event video for you watching on our YouTube channels, and you'll have captions in both English and Spanish. Para nuestros clientes que hablan español, vamos a publicar este video en nuestra página de YouTube con subtítulos en español. Jesse will also give us a quick recap at the end in Spanish. As a reminder, we're going to be talking about different resources that you can refer to, and we'll be posting those in our Facebook Live in the comment section. And feel free to ask us questions. We know we have employees that are logged in. We know we have members of the public, our customers. Please feel free to ask us questions, and we'll answer those time allowing. And with that, that's just getting out some of the housekeeping rules. I will let Paula give us an introduction and then an overview of how we're working nowadays and our focus on safety. So Paula?
All right, Melissa, thank you so much for becoming to be a pro at this. I told her that hosting our events and really making sure that we keep this going has been an assignment of hers that she's leaned into and kicked us off really well. So thanks again, Melissa. We continue to want to try to take a challenge that the world has, that San Antonio has, and create opportunity. We are physically distant, and that is a challenge, but we are more at CPS Energy, we are more focused on being in learning mode and being in partnership mode and being here for the community. And so we continue to be inspired to have these sessions. I'm here to talk about safety, and I'm here to talk about the way we look at it in terms of keeping everyone safe, our customers, everyone in the community, and our employees. But I got to still make sure I get this one message out consistently every time I can. CPS Energy is here for you. We are an essential service. We understand our job is to keep the lights on and give you peace of mind. This is why we have suspended the disconnect process. We still encourage you every time we can to have you call us so we can help you get through this time, so we can partner with you, give you a payment plan, and ultimately eliminate late fees and make sure that the collection process is one that doesn't get to be burdensome in the interim. And so we still bill, we still do everything in terms of sending you notices, but you calling us allows us to take some of the process, simplify it, and help you. So please give us a call. Our energy advisors are there waiting, excited, and about serving you. So that part of our People First mission continues. Inside of that, we have foundationally always focused on safety. And we think about safety in so many dimensions. Safety in terms of health is extremely important to us. And, we've always prepared with our business continuity plans and our safety programs. We had a pandemic preparedness plan. Lo and behold, here we are in COVID, and it was much more enormous than anyone thought, and definitely more than we thought. And I still say we are fortunate because we were early in recognizing that something was different, but it was still a very challenging perspective for us to go into. To make sure that we're able to service the full San Antonio metropolitan community and also contribute to the power needs of the state, we still have to do all we can to keep our 3,000 employees safe and thinking and in a mode where they're always trying to be mindful of things like masks. I wear mine every day. I come into the office every day. Our blue team is amazing. One additional shout out, last night's storm was just incredibly challenging on the community. And we still had employees that came to work, wore their safety equipment, practiced social distancing in the storm, and made sure that they worked on getting the restoration to occur. We don't control Mother Nature, but we really know how to do our jobs. But again, we have to do it through a prism now with a bit more conscientious effort, or maybe a significant conscientious effort about this safety perspective. So we want to tell you it's a priority of ours. First in, last out. First in, last out. Meaning we were practicing social distancing when everybody thought it was weird and strange, and we're gonna be practicing social distancing up until the time everybody thinks it's still strange. We've got to keep our employees who are critical and essential as healthy as possible. And so we study all types of things. We study, the effectiveness of the vaccines out there, or the issue about false positives and false negatives. We have a huge tracing program when we have someone who may have been exposed in some way, and things happen. The community is opening up, and rightly so. The mayor, the judge, the governor are trying to do their best to balance the economy. And so you see more freedom, but we still have a situation where we've just got to be as diligent and careful as possible. We have been fortunate. We have studied this locally. We have tapped on experts. We've studied it nationally. We have done research globally. But that says we're in learning mode. And so we're still trying to find the right mix of operating through a time where there isn't a vaccine. I want to thank Dr. Henrich again, who is a pillar in our community, absolutely well regarded, runs a wonderful organization, and he's an expert who's part of San Antonio and was able to make a bit of time to talk to us and share some thoughts tonight. And as we learn, we want the community to learn. These also continue to share this same type of all throughout our organization. And with that, that's our focus, and that's how we're trying to. Please understand again, if we don't come up and hug you, or shake your hand, or all of those kind of things, it is safe. It is to keep everyone around us safe, and we're going to do that so we can be here for you. So I'll turn it over to Melissa to help make that transition. But I want to thank everybody for supporting us and trusting us to help them.
Thank you, Paula. And the Dr. Henrich, as Paula mentioned, you all are pillars in our community, not only from the research and the education that you're doing with your medical students, but also you're a large employer of more than 7,000 local individuals. So we'd like to take this time for you to give us your insights on COVID and what we're doing well as a city and what we should be doing going forward. And we thank you in advance for your time with us. So with that, I'll let you give us your insights.
Well, thanks very much, Melissa, and thanks to Paula. Thanks for the great work CPS is doing. It's my pleasure to join you. I have to confess, this is not my cup of tea. I'm much better face-to-face with people, but our new reality mandates that we do it this way. So a couple things to say. We're all in a 24-hour news cycle inundated with information about this pandemic. But what is most on our minds are two questions that have not been answered and will be difficult to answer for the foreseeable future. The first question is, when will it end? And the second question is, will I be okay? And we have to find ways to stay in touch with each other, to stay close to each other, even though we have to be apart. And the social issue that Paula brought up just now especially in our community of San Antonio, where we take such a great pride in the warm relationship we have with each other, is on the shelf for a while until this gets better. So I'll start by saying pandemics aren't new. The world has seen many, many pandemics before. The last major pandemic was in 1918. It was called the Spanish flu. It was an influenza virus. We've also experienced the Asian flu, which was a serious virus in 1957. We had HIV/AIDS in the early 80s. That was limited to a more circumscribed population of individuals, but it was scary nonetheless because there were no treatments for it. And for a while, the cause of it was completely unknown. More recently, we had the SARS epidemic, the acute respiratory syndrome epidemic, which began in 2003. We had the Middle Eastern respiratory syndrome began in 2012. Happily, both of those turned out to be relatively small and did not reach the pandemic stage. The SARS-CoV-2 epidemic, the pandemic we are currently now dealing with, is a different story. I'll focus now on the fact that, as you know, sadly, just yesterday we passed the 100,000 death toll mark in the United States for this pandemic. In Bexar County, we've had 56,000 plus people tested for COVID-19. And as of yesterday, 95% of them have been negative. So there have been 2,480, almost 2,500 positive test cases for COVID-19 in the city of San Antonio. 22%, between 1 in 4 and 1 in 5 of the cases that we've seen here have been in asymptomatic individuals. This is one of the reasons the virus is such a stealth infection, because when you get the flu, you know you've got the flu, you know you're sick. When you get a cold, you know you've got the cold. But this virus, in fully 1/4 of us, 1/5 of us, affects us where we can be shedding it and infecting other people without knowing that we're infectious. So the fact is, this is a feature of it which makes it very difficult to corral. If it were more apparent that we had it, it would be easier to identify people. One of the new papers in the New England Journal of Medicine this morning suggested that what has been aiding the spread of the virus in nursing homes. And as you know, in San Antonio, we've had a particularly big problem with nursing home spread because people don't know they have it. There's no segregating them because they are asymptomatic. So that's one thing to mention about it. Most of the individuals who have had the virus are between 30 and 39 years of age. There's a preponderance of males, 55% males, 45% females who've had it. About 5% of the individuals who've contracted the virus, in our experience here, have required hospitalization. And unfortunately, 69 of these individuals have died. So the death rate here in Bexar County is currently standing at somewhere between 2 and 3%. That's the death rate. However, the actual death rate, given the fact that we haven't tested all the positives and all the asymptomatic people who are out there, is probably going to be in the range of under 1%. At least that's the prediction by experts nationally. Still, if millions and millions and millions of people catch the virus, a 1% death rate is still a major toll for our city, our state, our country, and for the world. I'm going to switch to talking about testing for a moment, and then I'll end up with some comments about the drugs and what's out there to be taken. The tests that we have are basically two. There's a diagnostic test that's an elaborate test that has to be run in a high throughput machine. And this test tests for the actual presence of the virus. This is the accurate way to diagnose COVID-19. The problem with this test is this. The problem is that it's a test in time. It's only one test on one given day. So you could have the test in the morning, and then what you could do is go to the grocery store or to another place like the cleaners or some other place, and you could be infected, and you could start shedding the virus in a couple of days after you had the negative test. So you're not absolutely 100% sure that following the test, if you have an exposure, that you haven't contracted the virus. However, the test has the virtue of being very, very accurate. And for tracking purposes, it's very accurate. So this test is a very good test. It's being performed by commercial laboratories, by our laboratories, and in several places around the city. And the mayor and the county judge have decided that we can open up these testing sites to people who just want to be tested. But I wouldn't recommend it simply because if you're asymptomatic and you haven't been exposed, it's very likely it's going to be negative. If you have a reason for being tested, you can get that test. But remember, it's only one shot in time. The antibody tests are an entirely different test. Oh, I should mention the test for COVID-19 is a test where you get a nasopharyngeal swab. It's like an elaborate Q-tip that they put into your nose. It goes all the way along the floor of your nose to your throat. You do it in one nostril, take it out and put it in the other nostril. Very accurate. It's not a pleasant test to take, but it doesn't hurt. I've actually had it. I had an exposure a while back, and so I took the test, and it's not painful. It's just a little uncomfortable. The antibody test, to test for an antibody made in the body to kill the virus, is more problematic. There are hundreds of these tests available, and they'll be advertised. You'll see them all the time. Currently, the FDA, the Food and Drug Administration, has approved only 3 of these tests for commercial use. Most of these tests have what's called a high false positive rate. Here's what that means. It means that when they do the test, that they'll find evidence that you've been exposed to a coronavirus. The problem is that 20% of cases of the common cold are due to coronaviruses. Hence, you might have had a cold last year or 2 years ago or 3 years ago and have an antibody in your blood to that virus. But it doesn't mean that you're immune to COVID-19. So you might erroneously think that you're immune. You might expose yourself, if you're a healthcare worker, to being around people who have the virus, thinking that you're okay, but you're not okay. So until this test gets more sophistication, until there's more widespread, easy testing for this test, and it's got much more accuracy, much more specificity, a recommendation would be to not do widespread testing with antibody tests. They have a long way to go before they're useful to us. What can we do if you catch the virus? What can be done? I'm happy to say a study done in part here, but around the country on a drug called remdesivir has shown positive results in reducing the fatality rate and reducing the length of time that the disease lingers by about 1/3 has had a positive result. It was a randomized controlled trial, a very powerful study, and it showed a positive result. There's a follow-up to remdesivir, using remdesivir and a drug that is a very powerful anti-inflammatory, and those studies are now ongoing. See, to beat this disease, we need one of 2 things to happen. We need an antiviral therapy that is effective and reduces the morbidity and mortality of the disease so we can socialize with more impunity. Or we need a vaccine. You read about last week the positive results on the Modena study that was from Boston, 45 people. A number of them have formed good results with the vaccine. The problem with it is in follow-up, a number of those people have had side effects from the vaccine, and so it doesn't look like that vaccine is going to have legs. This is very typical of vaccinology. It takes a while to develop a vaccine that is effective and safe. My personal prediction is it's going to be next year before we have such a vaccine. But I'm praying that I'm wrong. I'm praying that it's earlier. So what should you do in the meantime? I agree with the comments that have been made earlier that we have to open things up. We can't have people not be able to buy food, not have commerce conducted in the country, but we have to be careful. I know it is crude to use a mask and to wash your hands all the time and to practice social distancing. I know that these measures are incredibly backward in a world where we are used to taking a pill, having a treatment, and having it fixed. But the answer is we don't. And until that happens, you have to be careful. I haven't seen my grandkids. I haven't traveled to any place. I think I think it's essential that you be careful. And I urge caution in that regard. I'm glad CPS is urging caution in the workplace. I absolutely believe that in using these masks, which prohibit to some degree your ability to infect another person, it shows respect, it shows love, it shows concern for the other person. And I very much endorse that you do that. One other question that I was asked to address is, when will herd immunity occur? This will be my last comment. Herd immunity occurs when enough of us in the population have immunity to the infectious agent that the infectious agent can't get traction in the population anymore. That's why vaccines for measles, mumps, chickenpox, smallpox have been so effective. We don't see those diseases as much anymore because of vaccines. We have herd immunity when 80% of us have the antibody that's effective to thwart this infection. And we're a long way from that. Optimistically speaking, we might be at a range of 3 to 5%. So that's why using a mask, using the hand washing, hand sanitizer, keeping social distancing operant for right now, as hard as it is to do, is my recommendation for everybody. We're trying to be creative about how we see patients, how we open up our business where we have to actually touch people. We're doing all we can to keep them safe and keep our workers safe, keep our healthcare providers safe, and doing that. One particular area you might be interested in is in dental practice. We're testing our patients before they go to sit in a dental chair, because you have to work in somebody's mouth. There's aerosolized saliva, and that's the most infectious particle you could be exposed to. So we're testing people before they go to have those procedures done. Just an example of how difficult it is to bend a medical practice into being safe. But we're doing it. We're open for business. We want to take care of all the other things that make sure that they're not neglected. I guess my very, very last thing to say to everybody would be, don't neglect your other health problems while these things are going on. Go to your doctor, get your blood pressure checked, get your diabetes checked. Make sure if you have other chronic illnesses that you please take care of yourselves, and don't be afraid to go to the doctor, to the healthcare provider to have those things checked. I'll stop there and wish you all good health and safety, and hope you'll join me in praying that a vaccine is sooner than we think and an antiviral emerges relatively soon. Thank you for having me on this conference today.
Thank you so much, Dr. Henrich, and thank you for your leadership. And when you see a CPS Energy employee out in the field or in an office, you'll see us with our masks on too. So we really thank you for joining us. Speaking of
welcome.
people and taking care of our people, Lisa Lewis leads what that department sounds like, people and culture. That falls under HR, falls under there, wellness falls under there. And as we have this added element now of people working not only in an office, but from their homes, and Lisa's team has worked to adjust all of our employees in doing that. So Lisa, I want to give you some time to talk about what we're doing from a people and culture perspective, and again, and how we're keeping our people and our community safe.
Thanks, Melissa. As you heard, obviously, with a people-first culture in our work environment, our first step has been to focus on the health and wellness of our team. And just as Dr. Henrich said, you know, that starts with following all of our basic safety reminders, washing our hands, coming to work or being in the work environment only when we feel well. And that's been tough for our folks because we have people who take their jobs extremely seriously. They know power is a 24/7, 365 business, and so they don't want to be not available when they think they're needed. So even just convincing our folks that they can stay home when they have the sniffles or allergies is the right thing to do has been a bit of a challenge unto itself. And then when they're here, you know, maintaining our 6 feet of separation and you know, wearing our masks everywhere we go. So we started obviously with those basics. And as this has gone on, just like Dr. Henrich said, we've really tried to emphasize our self-care, you know, making sure that people don't neglect sleep and their, you know, good diet and getting their exercise in. It turns out, you know, a pandemic silver lining, I know for me, has been a lot more walks. You know, maintaining good boundaries when we're working from home. I find that I can often sit down and start to work in a homework environment and not get up again for another 4 hours because we're going from virtual meeting to virtual meeting instead of moving around the building, for example. So as you know, Melissa, we've tried to really focus on emphasizing these things to our workforce. And just like Dr. Henrich said, don't neglect your regular wellness needs. We early and quickly introduced virtual visits to make sure that our employees were staying in touch with their doctors. And we encourage people to do that, even if they feel like they can't get into an office as quickly as they'd like, or they're not quite ready, to definitely make use of virtual visits. And we also extended our services for our health plans to include virtual wellness coaching and virtual dietitian visits. People were already using these services that are part of our health plan, but being able to extend those and continue to use them as part of their virtual existence these days has actually been a big help. Another big challenge for us was getting people who are starting to, who are working from home even for the first time, to get themselves to set up a space that was ergonomically correct. And our occupational health team was just so much a help in getting a quick, you know, online tutorial together for people of how to do that, what you need to do to make sure you have a virtual setup in your home, and to try to stay as healthy as you can. And I will say one of the things that I found most interesting personally, I think one of the biggest challenges that our team members have dealt with is for the people among us who are parents trying to work and manage the school activities or the daily activities of their children while they're working has been a big challenge. And one of the things our leaders had to do was make a point of talking to their team members who had children at home about flexibility and adaptability, not because we couldn't be flexible or adapt, but what we found was that people were trying to do too much. They were worried that people were going to judge them for not doing their jobs well enough. And so helping people understand, we know that you're going through this and that this is really tricky and that you can give yourself some permission to be a little more flexible with yourself. You don't have to be perfect, and we know you're doing the best you can. And sometimes your little coworkers need a little more attention. So trying to make sure that we're being helpful. People, that's one of the things I love about working at CPS Energy. People here really want to do a good job, and they take a great deal of pride in their work. And so, people want to feel like they're doing it perfectly, and truly giving ourselves a little bit of grace in this time of chaos and stress is really, really important. Another thing that I thought was really interesting as we worked through this process is how much communication has changed. I think we are talking differently, but a lot more often. So in the work environment proper, in the field services or in the power plants, what we're seeing is that managers are going out to the teams. We ask the teams not to come in and be in congregated settings. So the managers are now going out to them, and in some ways they're seeing their managers more frequently in the field visits than they had before. And for people who were based in offices, many team members are getting to see each other more often because we're having video chats. And one of my personal favorites is I now know all the names of my team members' pets. So things that I just didn't know. I knew their families, I met their spouses or their kids. But one of my team members has a dog named Dexter, and I get to visit with Dexter at least once a week, and I kind of like Dexter. So it's been a fun thing. All of that said, it has been this pandemic has been interesting and challenging, but it's also created a lot of stress and anxiety. And I think with May being Mental Health Month, one of the things we should talk about is how much stress people are coping with. I read a study that had come recently from the Census Bureau, actually, that noted that stress since before the pandemic has probably doubled. More than 30% of the population is reporting some level of anxiety, depression, or extreme stress, where pre-pandemic that was in the 15 to 20% range. So people are just really dealing with a lot. And so I will leave the final thought of we really have to give ourselves and our family members and our coworkers a lot of grace. If we would all just practice a little more patience with each other and recognize that this is critical and it's a scary time, but if we'll just slow down and be calm and patient with each other, we will work through it together.
Absolutely, and you and your team have been a great resource for information for us to share with our employees. And I think another wonderful thing if there's one wonderful thing that has come from this, I feel like as we're doing more check-ins with each other as teammates, we often lead with a very genuine, how are you doing, to start off our conversation. So I think that's a wonderful environment that you all have fostered for us, and of course, under your leadership, Paula. We do
Absolutely.
have a few more. We're running a little bit behind. We may have to start extending these to 45 minutes, but we'll see how that works with our schedules. We did want to give Jesse Hernandez a couple of minutes to just do a high-level recap for us in Spanish. Jesse will also be on Univision later today at 7 o'clock, where he will talk about our customer service programs in Spanish and give some assistance there. So Jesse, if you could give us just a highlight and some recaps.
Great, thank you, Melissa. Un resumen rápido en español. Nuestra presidenta Paula Williams habló sobre la importancia de lo que está haciendo nuestro equipo en CPS Energy para mantener la distancia social. Es muy importante que sabemos que la electricidad es un trabajo de 24 horas, 7 días a la semana, y estamos aquí para nuestra comunidad para seguir con las luces encendidas. Y el tema común entre todas las personas que hablaron es la importancia de seguir usando nuestras máscaras, practicando la distancia social. El doctor Henrich habló también sobre los diferentes exámenes que hay para tomar para el COVID-19, pero hay un examen muy popular ahorita que es de anticuerpos, pero que no es muy razonable ahorita porque todavía hay muchos falsos positivos y que realmente no provee información. Y otro problema que hay ahorita con el examen es que al tomar el examen, una persona puede salir de recién tomar el examen y luego puede contagiar el COVID-19 yendo a la tienda recién salido del examen, y por eso no es mejor quedarse en casa, practicar la distancia social y continuar usando sus máscaras o su cubrebocas. Lisa Lewis habló sobre la importancia de todo lo que está haciendo nuestro equipo aquí en CPS Energy para mantenernos trabajando virtualmente, pero también para enfocarnos en nuestra salud de nuestro equipo, pudiendo trabajar juntos pero separados, usando toda la tecnología virtual y nos enfocamos en el cuidado de uno mismo, haciendo ejercicio, tomando descansos cuando es necesario, porque podemos trabajar tanto en nuestra casa que se nos olvida y el tiempo pasa muy rápidamente. Por últimamente, les quiero recordar que hoy en la noche a las 7 p.m. Vamos a estar en Univisión. Vamos a estar hablando nuevamente sobre nuestros programas de asistencia que ofrece CPS Energy y también programas que tienen la ciudad de San Antonio y el condado de Bear para ayudar a nuestros clientes que puedan necesitar un poco más de ayuda para pagar su recibo de luz. Quick recap, Melissa.
All right, just you did it. Thank you. Thank you again, everybody, for joining us. Paula, I'll let you close this out.
So we did run a little long, but wow, when you can get Dr. Henrich to go in and really slice through some of the clarity and the lack of clarity that's happening with the illness, but give us information, I think it's well worth it for his time. We will look for other opportunities to bring other people to share information. The last thing I want to close with is today I'm on using technology and innovation a lot, but I want to talk about one of our employees. This gentleman is Willie Mata, and he is, after 49 years of working for CPS Energy, he has decided that he is going to go into a well-deserved retirement. What we do here is we have the pleasure to have some of the finest people that I know, that I've ever met, who come here every day for the passion in this community. And they've made it so meaningful for me to think about people first. And so our care and our concern about your safety and trying to help reduce your stress level and trying to help people reach additional and new milestones, even at a tough time when we're all going through COVID. The person who's gonna venture into his retirement, but he will always have his CPS Energy family. San Antonio, you will always have CPS Energy here thinking about the things to better serve you. So I'm always rough, but I'm trying. Please remember, we're first in, we're first out. I wrote this down. Primero en llegar, primero en salir. We're first into this thing. We're going to be last taking care of you. We do appreciate our little coworkers. Thank you, Lisa, for that term. I like that. But we're going to keep coming to you with information. And Jesse, thank you always for bringing it home. I don't know how you do it. You relied on me to translate. We'd be here till next week. So all kinds of goodness. And Dario, thank you again for being our guest and helping us reach more people. So thank you. And thank you for giving us a little bit more time.